No doubt a huge gap exists in the Nigerian health sector when it comes to minorities, especially the LGBT people. Today we're here to ask why that gap exists and what we can do to close it. This is Untold Facts, and my name is Kiki Modi. Today on Untold Facts, the conversation is bridging the gap in access to healthcare for LGBT Nigerians. And joining me in that conversation is the Program Officer for Sexual and Wellbeing at the Initiative for Equal Rights, Martin Akoro.
Yes.
Thank you so much for coming.
Thank you very much.
We also have a clinical and public health physician, Dr. Kweju Adeniro. Thank you very much for coming.
Thank you for having me.
And you guys have done really extensive work in the health sector, and we're here to discuss why there is this apparent, gap when it comes to LGBT people accessing healthcare. So I'm going to start from you, Dr. Kweju. What are some of the general expectations that a patient might have, when they want to see a doctor?
Right. So I'm going to say that the gaps we have in the LGBT community accessing healthcare is very similar to the gaps, the issues that they experience accessing almost every other aspect of everything in the society. And it's so sad, especially because healthcare is built on the fundamental principle of helping a human being to be at their utmost functioning status. Yeah. So I do not believe that in this, I like to call it a hallowed space, right? Because we're talking about humanity and human beings. Yes. But I do not believe that, especially in this hallowed space, LGBTQ community should be experiencing the same things that they would anywhere else. It's a travesty already anywhere else, but even more so within this space. When a patient accesses healthcare, he or she or they expect privacy, they expect respect, they expect autonomy, and they expect the freedom of choice. And these are things that LGBTQI community cannot even express properly within the Nigerian healthcare system.
So that access to, privacy, non-judgmental, treatment, all of that, they don't have access to that.
No, especially when it comes to autonomy. And autonomy is the choice of a human being to exist in their own right, to choose who they want to be able to self-determine, and not to leave any of that part outside when accessing that space.
And this is just the bare minimum.
This is the very bare minimum.
Because we can go up to, the right to reproductive rights, which we know that the people in the LGBT community often suffer as well. So what are some of the global expectations, if we go outside of Nigeria right now, some of the global expectations of what a patient's care should be?
Like you rightly said, there should be right to access to healthcare system, confidentiality, the autonomy, whereby a person has a right to have information and express him or herself. So I feel these are the basic globally. So it's not pertaining to what the person in Nigeria is facing, or the person or the part of the country. But this is a global thing, and it's a uniform thing.
I mean, going by that, I think maybe Nigeria doesn't meet up to standard. That's what it means, that Nigeria doesn't meet up to standard.
First, I'm going to say several places in the world don't meet up to standard.
Okay.
So we're calling out several places that you would even still be amazed that LGBTQI members of that community are finding it difficult. We speak of this discrimination to healthcare in many places in Eastern Europe, for instance. We speak of this in places also where religion is quite heavy, a heavy part of the social fabric. So we speak of this in Islamic states.
Yes.
And then we also speak of this in very many Western countries, and we can speak of Western states within Western countries where there are differences between in some places to the other. So while Nigeria is the focus of what we're discussing today, it's fine, it's important to remember that very many places in the globe are still not free of this issue that we're talking about.
Okay, Martin, whose job is it to make healthcare accessible to everyone?
Apart from the fact that is the basic, it's part of the work of the government to make healthcare system accessible to all Nigerians, irrespective of their status or sexual orientation.
Yes.
And the fact that they are failing in this, that's why we have the non-governmental organizations taking up space as regards to providing these services.
Yes.
So it's as it is right now, it's a general, it's for everybody. Okay. So because the government are failing and individuals, non-governmental, private sectors are taking up the responsibilities as well.
The first, introduction to healthcare might be from the family unit, mothers nursing kids. Are there things that families should know on immediate care, when it comes to LGBT persons?
First of all, healthcare is a social security issue. It's not a very popular, these days, it's not a very popular stance because people try to, capitalism has said we should separate health as a social service away from health as, a capital, branch. Okay. But healthcare is, if we don't get healthcare right, then the very fabric of the society is threatened. Today's times, more than anywhere else, we know the impact of what an infectious disease could do literally to the entire globe. And this, so healthcare, I absolutely believe that it is something that I do not believe it should be taken into the realm of capitalism. I think it should be provided by the government. That said, every other aspect of the society has a role to play in ensuring that healthcare is well delivered, especially to the LGBT community. So leapfrogging from that into the family. Like I said, the issues that LGBT community members face in healthcare is really a reflection of everywhere else. So we can't talk about their lack of access to healthcare without talking about what happens in the family unit in the first place. How willing is this person, how willing is the family unit of this person to accept their autonomy and their choice in the first place? Yes. Because this is the unit through which that person will present themselves to interface with healthcare. Should a family of an LGBTQI person, recognize that they do have that member in their family, what tends to happen is this person is presented as a problem to fix. This person's sexuality is often presented as a problem to fix to the healthcare. So we're already dictating the terms in which this person enters that space in the first place. So we think about issues where a child is presented for conversion, for therapy, for, all of the founded in a certain stigmatization and a lack of understanding. And that often shapes the initial experience of that person with accessing healthcare. And what tends to happen is as that person grows more into an adult and all, the perception is already shaped and they do not enter that space with the proper balance of power that a patient and a doctor should. Yes. And that dictates the pace for the rest of their lives. So I'm going to say, yes, I do think the family unit has a very important role in shaping the initial contact of the person and the healthcare system.
And then healthcare can be, anything from even, sex education to, when we have rape kits, right? Do we have something that would cater to a person who has been, a man who has been raped by another man, things like that. And then there is the educational aspect of healthcare. How can we simplify healthcare as much as possible to make it accessible for lower class LGBT people?
Okay. Simplifying the healthcare system, I feel the first thing is making it accessible.
Okay.
And whereby you can walk into any primary healthcare center within your neighborhood and access care.
I think the first jump off is to separate healthcare, and I think it's very pertinent to this conversation. When we talk about the barriers that LGBTQI community are experiencing, first of all, we have to talk about access barriers to access of general healthcare.
Okay.
And then we have to now separate that from sexual healthcare. And then, so the first step to simplifying and, is first of all separating the two, and then trying to focus on the two, because the data actually says that there are two levels of discrimination, one more than the other.
Okay.
When LGBTQI access healthcare, general healthcare, apart from, the data doesn't support that there is as much discrimination as long as they do not present as LGBTQI. So to access health, infectious disease, a general infectious disease of a non-sexual nature, or a chronic disease of a non-sexual nature, as long as they do not present, which is a different conversation on its own, reeking in discrimination. But when they do not present as LGBTQI, they are able to access healthcare. In the course of accessing that healthcare and collecting data and collecting information, the data also says that the minute they present themselves as LGBTQI, very often the service changes. So somebody could go into the hospital for malaria and it's all fine and dandy until the person says, maybe I'm lesbian or I'm bisexual. That changes. Then it's a different situation completely when it comes to sexual health, which is a far more challenging healthcare service delivery for LGBTQI2 because of huge years of stigma around, because the stigma basically starts on the root of the stigma is the society has a problem with the way this person says, this is the way I do sex. And this is the way, So, and then very often, many of the social norms say that sexual infections or sexual disease, when they occur in LGBTQI, it is punishment. For the way, for their sexual preference or their sexual orientation. Because of this, the entire system is not responsive to sexual health when it comes to, and sexual health is an entire gamut of infectious diseases, chronic diseases, reproduction, education, emergency services, which covers rape and coercion, violence, which LGBTQI community are very, very exposed to. And the biggest irony is for a sector, for a part of the community that is so discriminated against, they are also the ones who are extremely exposed to sexual violence. For people who people say we don't like, they're very more likely to be, a lesbian, for instance, is very likely to access sexual health, from the being corrective rape, violence, beating. So sexual health has to be, and because the system is not prepared and not prepared to change to design this delivery, we often have NGOs, like Malton said, stepping in to do what should be provided at a systemic institutional level.
She has spoken about how generally healthcare is quite different when it comes to LGBT persons, not necessarily sexual health, regular health, just normal healthcare. When a person is presenting as maybe too effeminate as a man, they're discriminated against. Now let's talk about when we have a pandemic on our hands, for example, the coronavirus. Do you think that this is already faulty health system that doesn't allow or include LGBT persons would definitely not include at that pandemic level?
Definitely it won't, because the system, the stigmatization and discrimination is there.
Okay.
So if an effeminate person, like you rightly said, present himself or herself to an healthcare practitioner to be tested for coronavirus, even the perception of the healthcare person would, on realizing, okay, this person is too effeminate or something, and realizing that the perception or the attitudinal change of the healthcare worker might even prevent the person from going further with the test. So I feel with this, the stigma and discrimination thing is there and is affecting so many things as regards access to healthcare.
Now, the implication of all these things that we've highlighted is that LGBT persons are more likely to, for their illness to develop or degenerate into something else. And then we're looking at loss of life, possible loss of life, loss, permanent damage, it's just any crazy health, permanent situation on their life. Now we have a problem on our hands where we are harming people because we're not allowing them to access healthcare. What can we do to solve this problem?
Absolutely, you're right. It is true that if we are not deliberate about reaching out, we could have chronic diseases going on into further chronicity. Like, a simple example is when it comes to lesbians, when it comes to breast cancer screenings. There aren't enough breast cancer screenings that reach out and cater to that community. It feels as if we're not speaking to them. Reproductive health is, and personally, I've always felt that reproductive health in this country, even from an institutional level, is offered on a two couple within a family kind of format. And you can tell when you see, even at the government level, you go to a government hospital, they'll show a smiling man, a smiling woman, and a baby, and then they ask you to come for. So if you're not, if you're not married, it feels like you shouldn't be here. And this discrimination is even for heterosexual women who are not married. It's difficult to access reproductive or contraceptives. They ask you, where's your husband, or and talk less of lesbian, LGBT. The reproductive and sexual health is not ready. Of course, again, when we have attempted to offer sexual education, we do not speak, even today, of LGBT, so we don't speak about consent to them. And so, for instance, as a clinician, I often have to sit in my office and see LGBTQI members who don't really, have not really been preached consent the way I feel should have been preached, because it's not an essential part. So they're not really sure, the idea of autonomy, because nobody's speaking about it. They feel as, you have chosen this thing, so we cannot bring your autonomy. We are not going to discuss your choice. You're not going to, whatever you do, it's like, it's a dark field, and you're the one that chose to go into this field, so we can't cater for you. So you find, especially, and what's more telling, especially is for the younger the younger generation who are really young, coming into themselves. Nobody is catering for them. And so we're finding NGOs who are having to step in and, give them a community to come into, teach them the appropriate ideas about themselves and their bodies and their right and their choice, And it's a long way to go, but I'm glad to be on that side, doing that work. And it is the work of my life. It's what I'm very, very passionate about. And
amazing, and you do it so well. Thank you. So now we're looking at the way forward. What can we do? I know it's a difficult ask because we're in a country where it is even criminal. Same-sex marriage is criminal in the first place. So that means lots of the lifestyle is criminalized. But can the government do anything to at least ensure safety and access to health for LGBT persons?
So when we're talking about bridging the gap, I think we also need to look at the Same-Sex Marriage Prohibition Act, which has also backed up the structural barrier that has already been in place. So I feel the law should be repealed. And once the law is repealed, it's going to help in shaping the perspective of people and the attitudinal change of the health workers towards the LGBT person. In that way, we can easily, the gap can be bridged, whereby LGBT person can easily walk into a health center and access care. But another thing is, most of the public health facilities, some of them or most of them don't have that knowledge as regards to the peculiar needs of this community. So when you're talking about, you have some ailment or illness that is peculiar to the community, they have no idea. And instead of trying to figure out the way out, then their judgmental attitude comes up. So I think the law needs to be looked into, repealed in all form, and health workers sensitized.
Yes.
More trainings on how to handle LGBTI issues.
I mean, if we have a government or a structure that is that judgmental, how are we going to access funding, for example?
Exactly.
You know, and you've been in this space, you know, you've been program officer for years. You know the difference between funding and lack of funds is sort of life or death.
Exactly.
But, you know, do you see a glimmer of hope?
In Nigeria, I don't, for now, because most of the programming for LGBTI has been funded by international donors.
Okay.
So you hardly see governments, even they've not even provided for the heterosexual community, not to talk of providing service targeted at the LGBTQI. So the law is already in place. So and the government that is not in support of the lifestyle wouldn't want to provide service for them. So most of the programming we'll be doing over the past years has been funded by international donors.
It's quite unfortunate, and the gap keeps widening and widening until we take decisive action. So on bridging the gap in access to healthcare for LGBT Nigerians, do you have like a final word of advice for every stakeholder involved?
Okay. So my first word is, I'm jumping off what Malta said, which is in no uncertain terms, repeal the law. There's not one single use. The law does not have one single benefit, not one. So that is very necessary. And it just acts as a systematic barrier to funding, to health access, to discrimination, to stigma, to emergency services, to service delivery. And it does all of this without having one single benefit. So without a doubt that. And then we generally should recognize LGBTQI members as legitimate members of our family, and then prioritize human rights.
Yes.
You know, so once we continue to prioritize human rights, and there's an essential freedom for every single Nigerian, and then there's no need to even look at them, separate. We're all the same thing, except when it comes to healthcare services, when we must do even better. So that's the only kind of discrimination I'm happy to contribute to, which is we must do better for them. So that's my final word.
I think another thing is the perceptions needs to improve.
Okay.
TS did something on this NOI poll on social perception for LGBTI. That was in 2015, and we saw that the acceptance rate as at that time was 90% thereabout. Okay. And in 2017, the acceptance rate, dropped. Will I use the word dropped to? It didn't drop. It increased. It increased to 70 or 65 thereabout. Okay. So we are seeing an increase in social acceptance of the LGBT community. Okay. So, and when this social acceptance comes in, it trickles down to the health sector as well. And they can easily access, the community can easily access healthcare facilities in public health sectors as well. But for now, I think much of the task is being done by the non-governmental organization, which we must give them credit for.
All right. Thank you so much, Martin. Thank you so much, Dr. Peju. We all have a huge role to play when it comes to healthcare. When it comes to access to healthcare, it's the very fabric of our society, and much of what we build is dependent on that. And much of how much we would stick together during pandemics or epidemics depends on how well everyone and every human accesses healthcare. And that is why it's very important that this huge gap that we have currently for LGBT persons to access healthcare should be bridged. And this has been Untold Facts. My name is Kiki Mordi. Thank you for watching.